Welcome back. It's time for Wellness Wednesday, and we've been seeing the impact from the smoke from the wildfires in the prairies in northern Ontario here at home, agitating breathing concerns and even our eyes.
And joining us now for a look at how you can take care of your health amid all of this haze is Dr. Allan Grill, Chief of Family Medicine at Oak Valley Health, Markham Stouffville Hospital. Dr. Grill, good to see you this morning. This is something I think most of us have been experiencing at least for the last week or so, as that particulate matter has been coming in from west and northern Ontario here. So what have you been seeing with the air quality issues in your own clinics?
Yeah, and good morning to you both. So, we've had these wildfires and they produce a lot of smoke. And then that smoke sort of causes air pollution. And that air pollution lowers the air quality outdoors. And those particles that you talked about, they can get into people's lungs and cause a lot of irritation. So people come in and say that they're coughing a lot, they're having some trouble breathing. They can also have irritation in their eyes, so they come in and complain about itchy, watery eyes. If it gets in their nose, they're very congested. If it gets in their throat, they complain of scratchy throat. They can even have headaches as this sort of like haze is falling over the city. And, some of these symptoms are very similar to seasonal allergies, and often people tend to use a lot of over-the-counter antihistamines, and in particular, something like Reactin. We're trying to stay away from the old antihistamine like Benadryl that causes a lot of drowsiness. They're using these nasal steroid sprays to clear their nose and even eye drops. So we're seeing a lot of that coming into the office these days.
Yeah, I thought it was allergies for me, Dr. Grill. I've had a leaky left eye for a few days now, and now I'm thinking this could be the result of the smoke. Dr. Grill, so when we see this intensity, this kind of intensity of bad air, who are the people who should be most concerned by this?
Yeah, so the people at highest risk of sort of health effects of air pollution and low air quality. So it starts off, infants and young children, their lungs are still developing, people with chronic medical illness, and that usually includes sort of like older, or people that are seniors, people that have known lung disease. So, conditions like asthma or, chronic bronchitis, emphysema, people that have heart disease are at high risk, and anyone that's pregnant. It also affects sort of, people that are otherwise healthy, but might have to increase their exposure to this air pollution. So a lot of people whose jobs force them to work outdoors, a lot of athletes whose sports are outdoor sports, so they can be affected as well.
I'm curious, the air quality for the next couple of days is forecast to be moderate, Dr. Grill. So two-part question. What precautions should the vulnerable, populations be taking? And secondly, how do you know as a doctor whether it's typical allergies or whether it's from the wildfire smoke?
Yeah, so to answer the first question, I would say, so we have this thing called, the air quality index, and it's really just a scale that helps people understand what is the quality of the air outdoors. It's on a scale of 1 to 10. The higher the number, the greater the effect that pollution can have on our health. And, anyone can look up the air quality index. You just go to the Government of Canada website, you can Google it, and it gives you a number. So over the next few days, it says that the air quality index, here in the city is going to be, 4 to 6 or wherever you are. So that's moderate. So that number should change your behavior. So if it's moderate, you might want to avoid strenuous activity outdoors. And if you're in that sort of high risk category we talked about, you might actually want to stay inside. And, if you are going to have to be outdoors, it's actually recommended you wear a high quality mask, even going back to those N95 masks that people wore during the pandemic. And if you're staying indoors, make sure if you have the luxury of air conditioning, turn it on, try to close the windows, get an air purifier. In terms of how to distinguish between are my symptoms due to the air quality versus seasonal allergies, from a treatment perspective, we're still going to, use the same tools in our toolbox to help make people feel better. But if you really think it's seasonal allergies, usually people have those symptoms at certain times of the year. It's not necessarily correlated to the air quality index. Sometimes we have to send people for allergy testing. But for the most part, when we have all this media attention about how bad the air quality index is, and we start to see more people coming in with these symptoms, it's likely due to air pollution.
Okay, very good advice and insight. Dr. Allan Grill joining us live this morning for Wellness Wednesday. Appreciate your time. Thank you so much, and we'll chat again soon.